There is a clinical term for what is happening inside your ear right now. Neurologists call it auditory nerve deprivation. And once you actually understand what that means, not just the words, but the mechanism behind them, the way you think about that sound in your head is going to shift completely. Because 3 months from now, you could be sitting in a room with no television on, no fan running, no background noise you put on to cover up the other noise. And it could just be quiet, not silence forced by distraction, actual quiet, not because you found some miracle product, but because you finally gave your auditory system what it has been running low on, possibly for years. But right now, you know the sound. You don't need me to describe it because you already hear it. Maybe it is a high whistle that starts the moment you wake up. Maybe it is a low, steady hum that gets louder in the evening. Maybe it is a pressure sensation, almost pulsing, that no one else around you can hear. You have probably turned up the television to drown it out. You have probably mentioned it to a doctor and been told it is common, that it comes with age, that there is not much to be done. Here is what most people sitting where you are right now have never been told. There is one specific error, a sequencing error, that will take everything I am going to show you today and make it completely useless. I will tell you exactly what it is, but not yet, because first, you need to understand what is actually going wrong inside your ear. I am Dr. Zion Adetola, and I have spent over 18 years working at the intersection of neurological health and clinical nutrition. What I want to walk you through today are 7 specific nutritional factors, 7 things I call the 7 nerve defenders, that research shows have a direct relationship with the auditory nerve's ability to protect itself and begin recovering. I want to be honest with you from the start. This is not a fast process. The auditory nerve does not recover quickly. But for most people, the first real shifts, not complete silence, but stretches of noticeable quiet that weren't there before, tend to begin somewhere between weeks 3 and 6 of consistent, structured nutritional support. Let's start with the deficiency that is most common and also the most damaging. Picture your inner ear as a room sitting at the very end of the world's narrowest hallway. The blood vessel responsible for feeding your cochlea, the one that supplies oxygen to the tiny hair cells that detect sound, is so narrow that even a slight change in local blood flow or inflammation can cut off the oxygen supply to those cells entirely. And when cochlear hair cells are deprived of oxygen, they don't simply go quiet. They begin misfiring. They send random signals up the auditory nerve. Your brain receives those signals and tries to make sense of them, and it translates them as sound. That is what you are hearing. That is the ringing. Zinc is the primary antioxidant defense of the inner ear. Its job is to intercept and neutralize free radicals, which are unstable molecules that attack cochlear hair cells from the inside. When zinc levels fall, and they fall more often and more quietly than most people realize, those hair cells begin to degrade. The cell walls weaken. The electrical signals they produce become erratic and uncontrolled. Your brain hears that chaos and registers it as a tone. The most reliable food sources of zinc for auditory health are oysters, pumpkin seeds, and grass-fed beef. 2 tablespoons of raw pumpkin seeds daily gets you roughly 1/3 of your recommended intake. Easy to add to a meal, easy to eat as a snack. If you are thinking about supplementation, the forms your body actually absorbs well are zinc picolinate and zinc bisglycinate. A typical adult dose sits between 25 and 40 milligrams per day. Talk to your doctor before you start, because zinc in excess can interfere with copper absorption, and that matters. Here is something worth pausing on. Zinc deficiency is one of the most common nutritional gaps in adults over 50. Research suggests roughly 1 in 4 people in that age group is running low on zinc, and the majority have no idea because standard blood work rarely screens for it. You may have been zinc deficient for years without a single test flagging it. Now, the nutrient that may have the most direct relationship with the specific sound you are hearing right now. Your auditory nerve is wrapped in a protective layer called the myelin sheath. Think of it the same way you think of the plastic coating around an electrical cable. When the insulation is intact, signals travel cleanly and quickly from your ear to your brain. When it begins to break down, because B12 levels are too low, the cable becomes exposed. And exposed cable doesn't transmit cleanly. It sparks. It short circuits your brain, trying to interpret those corrupted signals, reads them as sound. What makes B12 particularly complicated in the context of tinnitus is this. The reference range on a standard blood test is not the same as the optimal range for nerve regeneration. Many people with significant tinnitus will have B12 levels that sit inside the laboratory's normal window, but are still too low for the myelin sheath to repair itself effectively. A study published in the Journal of Laryngology and Otology found that B12 supplementation in patients with noise-related tinnitus produced measurable improvement in symptom severity within 8 to 12 weeks. The most bioavailable form of B12 is methylcobalamin, not cyanocobalamin, which is the cheaper version most standard multivitamins use. If you can't get your levels tested right away, a daily sublingual methylcobalamin supplement, around 1,000 micrograms, is a reasonable baseline for nerve support. Food sources include wild-caught salmon, sardines, beef liver, and eggs. If you are already eating these regularly and still have symptoms, the issue may not be what you are eating. It may be how well your gut is absorbing it. Some common medications, including metformin and certain acid-blocking drugs taken long-term, are known to significantly reduce B12 absorption. If that applies to you, that is a conversation worth having with your physician. I want to stop here because I know what some of you are already thinking. You have heard about B12. You tried it, nothing changed. And that response is completely valid because the form matters, the dose matters, and most critically, no single nutrient is going to do this job alone. This is a system. Each one of these factors supports the others, which brings me to the one that almost everyone overlooks, and the one most likely tied directly to stress. When your body is under stress, and here I mean any kind of stress, a loud environment, a poor night of sleep, a difficult week, your nervous system releases a neurotransmitter called glutamate. Glutamate is the accelerator of the nervous system. In the right amounts, it is essential. In excess, it overdrives auditory neurons, forcing them to keep firing when they should be resting. Magnesium is the brake. It blocks a specific receptor in the brain called the NMDA receptor, which is the main target of glutamate overload. Without sufficient magnesium, the auditory system runs continuously with no mechanism to slow down. Research from the University of Michigan found that magnesium deficiency meaningfully amplifies noise-induced hearing damage, and that supplementation reduced tinnitus symptoms in a significant percentage of participants in a controlled trial. Quick question, and I am genuinely asking, do you notice the ringing gets worse on days you are more stressed or when you have not slept well? Drop yes or no in the comments. The pattern in your own symptoms will tell you a great deal about which of these deficiencies is most relevant for you personally. Two of the best dietary sources of magnesium are dark leafy greens like spinach and Swiss chard. and dark chocolate at a cacao content of at least 70%. 1 cup of cooked spinach gives you roughly 40% of your daily requirement. For supplementation, look for magnesium glycinate or magnesium threonate. The threonate form crosses the blood-brain barrier more effectively, which means more direct access to the overactive auditory neurons. A standard dose is 300 to 400 milligrams in the evening. Evening matters. Magnesium also has a meaningful effect on sleep quality. And sleep, it turns out, is when the auditory nerve does most of its active repair work. 3 nutrients down. Now the one most people dismiss entirely because they associate it with bones and sunlight and not much else. Vitamin D3 functions less like a traditional vitamin and more like a hormone. It activates specific receptors throughout the nervous system, including within the auditory pathway itself. And it directly regulates genes responsible for protecting cochlear hair cells from oxidative damage. A study published in the Annals of Otology, Rhinology, and Laryngology found that patients with chronic tinnitus had significantly lower D3 levels compared to control groups, and that supplementation produced meaningful reduction in tinnitus severity in participants who started with deficient or insufficient levels. The mechanism appears to work in 2 ways. D3 reduces systemic inflammation, which improves blood flow through that narrow vessel feeding the cochlea, and it directly activates protective pathways inside the hair cells themselves. Most adults need between 2,000 and 4,000 IU of D3 daily. Take it with a meal that contains fat, because D3 is fat soluble and absorption drops significantly without it. Now the nutrient that connects all of the others. The cell membranes of your cochlear hair cells are made up largely of omega-3 fatty acids, specifically DHA. When your diet is chronically low in omega-3s, those membranes become rigid, less fluid, less able to respond to the microscopic vibrations that represent incoming sound. But there is a second mechanism more directly tied to tinnitus. Omega-3s reduce blood viscosity. They make the blood more fluid. And remember that microscopic vessel feeding the cochlea? Even a modest improvement in blood thickness can meaningfully increase oxygen delivery to hair cells that have been struggling. A meta-analysis of 7 clinical trials found that regular omega-3 intake was associated with a 31% reduction in age-related hearing decline in adults over 50. Wild-caught fatty fish like salmon, mackerel, sardines, and herring are the most bioavailable sources. 2 to 3 servings per week, baked or grilled. If you supplement, look for a product specifying at least 1,000 milligrams of combined DHA and EPA per serving. Algae oil is worth considering if you prefer to skip fish entirely. The DHA found in fish actually originates from algae. Algae oil gives you the same compound at the source. Now, I made you a promise at the beginning of this video. The one mistake that breaks the entire system. We are almost there. But first, I need to cover 2 things that are almost certainly making your situation worse right now. And one of them is probably in your kitchen. And one is probably in your medicine cabinet. 2 substances block zinc absorption in a way most people never account for. Caffeine and phytates. Caffeine increases zinc excretion through the kidneys. 2 to 3 cups of coffee a day can reduce your zinc absorption by as much as 30 to 40%. That does not mean you need to stop drinking coffee. It means the timing matters. Phytates are naturally occurring compounds in processed grains and many cereals. They bind to zinc in the digestive tract and carry it out before it can be absorbed. Many people who are genuinely trying to do everything right nutritionally are quietly undoing the benefits by not accounting for these two factors. The fix is straightforward. Separate your zinc, whether from food or supplements, from your morning coffee by at least 90 minutes. If you eat oats regularly, soaking them overnight significantly reduces their phytate content. And take zinc in the evening with food, not first thing in the morning. Now the medicine cabinet. Certain common medications are classified as ototoxic, meaning they can directly damage the hair cells of the inner ear. The most widely consumed ototoxic substance is aspirin, not an occasional tablet. Consistent daily use at doses used for pain management has been shown to reduce cochlear blood flow and damage outer hair cells. This effect is dose-dependent and in many cases reversible if caught early. But for someone taking aspirin every day over months and years, the cumulative effect is genuinely worth discussing with your doctor. Other potentially ototoxic medications include ibuprofen at high doses, certain diuretics, and some classes of antibiotics. This is not a reason to stop any medication you have been prescribed. It is a reason to ask one specific question. Ask your doctor directly. Are any of the medications I am currently taking known to affect hearing or tinnitus? Write that down if you need to. The answer may open options you didn't know you had. Now stop. Before we go any further, I need to tell you something I deliberately held back. For about half of the people watching this right now, following what I have described will produce noticeable results within 4 to 6 weeks. A reduction in the intensity, longer stretches of quiet during the day, moments where you realize you have not heard it for the past hour. But for the other half, nothing will change. Not because these nutrients don't work, because of a sequencing error that eliminates the benefit before it has a chance to build. Here is the mistake: starting everything at the same time. When you introduce multiple supplements simultaneously, certain combinations actively compete for absorption: zinc and copper, iron and zinc, calcium and magnesium. If you take them all together with no structure, you absorb a fraction of what you would otherwise receive. Here is the protocol that actually works. Weeks 1 and 2, start with zinc and magnesium only. Let your baseline absorption pathways stabilize before adding anything else. Weeks 3 and 4, bring in B12 and D3. Your zinc levels are now sufficient to support the enzymatic processes that make B12 conversion more efficient. Week 5 and beyond, add omega-3. At this point, your cell membranes are ready to integrate DHA effectively. And throughout the entire protocol, keep all of these separated from caffeine by a minimum of 90 minutes. Now, the open loop from the start of this video. The one thing that makes this fail for most people is not the supplements. It is not the sequencing. It is consistency. The auditory nerve regenerates slowly. The myelin sheath, once it begins rebuilding, takes time. Cochlear hair cells do not transform in a week. Research consistently shows that the first real shifts in tinnitus severity begin between weeks 3 and 6. And the period from week 1 to week 3, before anything is noticeably different, is where most people stop. Don't stop in the gap between starting and seeing results. The gap is where the repair is already happening. Let me leave you with something concrete before we finish. A single meal that delivers all 5 of the core nutrients together. I call it the repair meal. Start with wild salmon baked around 150 grams. That covers your omega-3, your D3, and a meaningful portion of your B12 for the day. Serve it on a bed of fresh spinach dressed with olive oil and lemon. The spinach delivers magnesium. The olive oil provides the fat needed for D3 to absorb properly. Scatter 2 tablespoons of raw pumpkin seeds on top. That's your zinc. Finish with freshly grated ginger, not powdered, fresh ginger. Ginger contains active compounds called gingerols and showgirls that studies have linked to improved microcirculation, blood flow through small vessels, potentially including the vessel feeding your cochlea. 1 meal, 5 nutrients, 30 minutes to prepare. Here is what I want you to do after this video ends. First, request a B12 and D3 blood test at your next appointment. Ask your doctor to include them specifically. Knowing where you actually stand changes the entire approach. Second, start with zinc and magnesium this week, not next Monday, this week. Third, and I really want you to do this one, come back next week because I am going to go into detail on how to read your B12 blood test properly. Specifically, the difference between the normal reference range and the optimal range for nerve regeneration. That distinction alone may explain why nothing has worked for you before. One more thing, do you know your current vitamin D3 level? If you have had it tested recently, drop the number in the comments. Based on what the research shows about deficiency rates in adults, I would estimate more than half of you watching right now are in the insufficient range. If today helped you understand something about what is happening in your body that you didn't understand before, a like helps this reach other people who have been told there is simply nothing they can do about the ringing. There is something. They deserve to know it. I'm Dr. Zion Adetola. Take care of your hearing, and I will see you in the next one.